we have a ton of bills going on, finally. You've been hearing about health care reform, and there haven't been actually any bills. We're starting now to get language out. In the previous months, there have been position papers and different things coming out, which was intentional. It's really hard to fight an opponent. Is that better? Really hard to fight an opponent when there's no specific language. And that's what President Obama has been doing since the campaign. We are starting to get language, and as you can imagine, none of it is good. There are bills coming out from the Republican side that you will probably be disappointed in. I don't know how else to say it. They are not the bills that would be written if the Republicans were in the majority. And I will add as an aside, the Republicans were in the majority, and they didn't bother to write the bills when they were in the majority. So, as you can see from my attitude, I'm not sure there have been a lot of friends up on the Hill either way. So that hasn't been encouraging. The political landscape is part of what's going on up in the Hill has been, up in the last few months, has been homage to Senator Kennedy. With his dying gasp to pass health care, here it comes again, are everybody ready? Reform, say it with me, reform. Healthcare, and I apologize, but I'm using the terms. We call it medical care, they call it health care. Okay? So when I say health care, I actually know the difference, but I'm using their language because I have to go into that world. And you know, when you go to a foreign country, you really do need to speak the language to get along. So that's what I do. So that's some of what's been at work, is Senator Kennedy. Everyone, of course, with everything else, has been afraid to take on the new administration. And here's what's been particularly troubling, is one of the features of what's been proposed is an individual mandate. Is everybody aware of that? Individual mandate. The state of Massachusetts, a couple years ago, passed a requirement that everyone have insurance. Every individual have insurance, and you will pay a penalty if you don't have insurance, health care insurance, just like states have done auto insurance. Many of us think this is unconstitutional carried out at the national level, but we're really not interested in going far enough to have to do the constitutional test on it. We'd like to stop it before it starts. But the attitude among the Republicans, who you would expect to stop this, in government mandates, expansion of government, has been, well, we don't think the Democrats will be able to pull it off, and they seem unorganized, so maybe we won't take a stand. Maybe we won't take a stand right now on the individual mandate, if we don't have to. And we say that is line in the sand. If the federal government can tell you that you have to have a medical insurance policy, health care policy, then we've crossed over. And I heard Dick Armey give a really good speech on this, that that's not even about medicine. That's not about being a patient. That's about overreaching government in America. And anybody who's involved with the taxpayer movement or Campaign for Liberty or any of those movements should be horrified at the idea of the federal government requiring you to have a medical insurance policy. Okay, now let's answer the question. How is that different from auto insurance? You're required to have auto insurance, as you can't get your license tabs. States can do things that the federal government can't. Plus, you don't have to drive a car. If you choose not to, if you think that's an unfair mandate, you can choose not to drive a car. I have no way to opt out of living in a good way. So I'm stuck. Also, as an argument, interestingly enough, the states that have mandates for auto insurance have as high a rate of uninsured motorists as do states that don't require it, that don't have a mandate. So in essence, it isn't even effective. Okay, if anybody asks, that question comes up a lot. So we're quietly trying to convince the supposed conservatives up on the Hill that individual mandate, line in the sand, and that they have to start getting on board opposing that, and very vocally. Okay, so you haven't heard too much about that. The other thing that's already passed, and I mentioned it today for those of you here, is competitive effectiveness research. We have billions of dollars allocated in the stimulus bill for a federal coordinator under HHS to start throwing money at doing comparative effectiveness research. Comparative effectiveness research equals the NICE system in the UK, which is the Oregon system of rating. Who's worth effective treatments and who's worth getting them is what it comes down to. That's what you're going to see in the video later tonight. So I don't need to spend a lot of time on that, but that's money's already being spent on that. I would urge you, first of all, everybody if you have your pens handy, before we proceed any further, I want you to write down a phone number. Area code 202. 202-224-3121. That is the switchboard for Congress. You can call any member and ask for their office in DC at that number. And I'm going to be asking you to use that number a lot in the next couple of months. 202-224-3121. And you can call and just ask for anyone. The political landscape, the other part of the political landscape is things are different this year. In 1994, some of you commented on my no government run healthcare button. I pulled this out. This is from 1994. So that makes me green because I recycled it. I actually still have a box of them. I figured I'd need them again. Last time around, the insurance companies put a lot of money behind the Harry and Louise ads and really fought tooth and nail, as did the National Federation of Independent Businesses and the National Chamber of Commerce. The AMA, even lukewarm, didn't throw in with Hillary Care last time around. Very different this time. You saw the Big Five stand up with President Obama a few weeks ago. The hospitals, the unions, the AMA. Who did I miss? Thank you. And they are throwing in because their attitude this time is that if they leave the table, they're the ones who will get, pardon my language, screwed. So they all want to stay in there, and the hospitals have thrown in, and the insurance companies have thrown in this time, because they figure a seat at the table to keep things from getting worse. Now, I'm very disturbed about the AMA because the AMA stood up there and said, we're going to cut money, we're going to cut money, we're going to cut costs, and yet they're still out screaming for increases in the SGR. So on one hand, they're saying, we'll cut money, but we still want money, but we're not doing this. I want to remind you, the AMA took a real good stab at unionization in 1999 and actually set up the union and spent millions of dollars on it, and then had to sort of back off and yank funding for it in 2004. I'm thinking that perhaps the deal that's been cut is that the AMA is moving towards is going to do a unionization push again, because they're standing up with the union folks, and they're saying that all of these folks should be unionized, and that may be some of the deal that's being cut. There's stuff, we don't even know about yet that's going on.